Uh, okay, so today we'll be discussing about the surgical anatomy of the facial nerve. Already you know about the basic anatomy and what is the facial nerve and applied anatomy you already know. So today we'll be dealing more about the surgical part, like what are the things we need to consider we deal with the facial nerve, which is one of the very important cranial nerve in our head and neck region. So I'll be sharing the PPT with you. Okay, so this is the okay. As we all know, this is the facial nerve. So facial nerve is the seventh cranial nerve. Okay, there are actually 12 number cranial nerve, and this is the seventh cranial nerve. And this is the nerve of the second branchial. And it has got this facial nerve has got facial nerve proper and the intermediate nerve. And as you know, the nerve it consists of fascicles and increase in number along the course of the nerve. And it consists of facial nerve consists of motor, sensory, and parasympathetic fibers. And mainly it supplies to the facial muscle. You can see this is a facial nerve where it branches in the face. Okay, and there are these are the five terminal branches. More detail about the each branches we'll be dealing with later, and it consists of mainly three nuclei. That is the superior salivatory nucleus, lacrimatory nucleus, and the nucleus of tractus solitarius. And you can see in the diagram, this is the anatomy of the facial nerve. And here you can see this is the region where the facial nerve originates. And this is the pons region in the brain, mid part of the brain. And here you can see the superior salivatory nucleus. These are all the nucleus of the facial nerve. Okay, these three. And sorry, this is an abducent nucleus of the abducent nerve. And from here it starts. Okay, this is the seventh cranial nerve and the facial nerve. Okay, and once it enters from the pons, it enters within the cranium. This is the optic canal, and this in the optic canal it will give branches. These are the various branches. Okay, and nerve to the stapedius. These are all the various branches, and along with the lingual nerve, it supplies the tongue, anterior to the root of the tongue, that is gives the taste sensation. And finally, the terminal branches, once it exists from the stylomastoid foramen, it gives out the five branches, terminal branches to the face. And this is what we already discussed. This is the facial nerve, that is where it is attached. The nucleus is attached in the midbrain, and it has got facial nerve nucleus, motor and sensory, which attach to the, this is a pons, and here is the region where it attaches. That's the lower part of the pons. Okay, so again, the parts of the facial nerve can be like there are intracranial parts, intratemporal part, and the extratemporal. Okay, intracranial means within the cranium. These are the from pons to the internal auditory canal. That is the part of intracranial part of the facial nerve, and this is the intratemporal part. That is intratemporal is from internal auditory canal to the stylomastoid foramen. Once it emerges from the stylomastoid foramen, that is the extratemporal part. So from the stylomastoid foramen to the termination of its peripheral branches. So these are the segments, the facial nerve we already discussed, and this is the intracranial part from where it originates from the pons, and again it enters to the internal auditory canal. And once it enters the internal auditory canal, that is the meatus, it nerves enters the foramen of internal auditory canal, and here you can see that this is the within the canal. That is from the cranium, it enters within the canal. This is the, it has got the tympanic internal auditory porus, and it has got the labyrinthine and the tympanic portion. And this is where it is just behind the mastoid region. And again, this is the various ganglion. These are the ganglion related to the facial nerve. That is a geniculate ganglion. And this is the tympanic segment. Tympanic means within the ear canal. And this is the second genu where it enters to the mastoid segment. And from there, the extracranial force, once it comes, emerges out of the stylomastoid, it branches into 5 branches. So these are the branches of the facial nerve. And once we come to the surgical anatomy, surgical landmarks, you can see that is, it is just for the parotid surgery, mainly it is just below, behind your ear. That is the tympanic part. So it is just below that, behind that. So, and the styloid process is there, you can see, and this is the parotid region. Okay, and this is the styloid process, and this is the where your nerve can, facial nerve originates. And these are the branches as we already discussed. And these are the diagram which clearly shows what are the branches of the facial nerve. Nerve to stapedius, where it supplies the stapes muscle, and this is the chorda tympani, along with the lingual nerve, which supplies the anterior part of the tongue. And these are the detail of the each nerve. That is a greater petrosal nerve. As we already know, this is the greater petrosal nerve, where it originates from the geniculate ganglion, and it leads the cranial foramen through the foramen lacerum. And nerve to stapedius muscle, that is in the originates from the facial nerve, and it supplies the stapedius muscle in the middle ear. And again, chorda tympani, it along with the lingual nerve, it joins the lingual nerve, and it supplies the anterior two-third of the tongue. And these are the terminal branches. Terminal branches means these are all the terminal branches which help for the supplies the facial, it supplies the muscles of facial expression. As you know, there are various muscles of facial expression. These muscles help for the proper expression, giving the expression for the face, and these are all supplied by the facial nerve. So here you can see the you can make a wrinkles on your forehead because your facial nerve branch, that is a terminal branch, temporal branch, it can supply the this muscle, that is the frontalis muscle, and that it leads to the wrinkles. So it supplies the frontalis, that is the muscles of the forehead, then your orbicularis oris, that is the anterior temporal region, that is the superior part of your eyes, then corrugator supercilii, all these things. Okay. Then the other branch, second branch, that is a zygomatic. It is in the zygomatic region. Okay, so it leaves the parotid gland. Okay, and it supplies the zygomatic region. Okay, and it supplies the inferior part of the orbicularis oris. Then comes the buccal. Buccal, it emerges from the anterior border of the parotid, and it supplies the muscles of the upper lip and the muscles of the nose. Okay, and it supplies mainly the orbicularis oris. That's why you are able to whistle blow your lips, because of the supply of the buccal nerve to this muscle. Then comes the marginal mandibular. Marginal mandibular, it supplies the muscles of the lower lip. That is the depressor angulae oris and depressor labii inferioris. Then comes the cervical. Cervical branch, it leaves the parotid gland, it runs downwards and anteriorly, and it supplies the platysma. Okay, so these are all the terminal branches of the facial nerve. Okay, so coming to the surgical anatomy part, mainly we have to, when we go for the surgeries, like in the parotid surgery, mainly because your terminal branches of the facial nerve was branching out of the parotid gland. So you have to be very careful when dealing the parotid surgery. This you should be careful about these five branches since it is emerging from your parotid gland. That is in the parotid surgery. And in the TMJ surgery, that is temporomandibular joint surgery, any issue happen, you have to be careful with while dealing in the those cases. That is in the surgical management of the TMJ surgeries.